You're listening to Lead, a CEO podcast. All right, Brenda, Chuck, we're up. All right, Brenda, good to see you.
Great to be here.
Yeah, we've been really excited about this conversation ever since you agreed to do it a few months ago. So let's just start, Brenda. Let's just start right into it. I know you as a fabulous, progressive, strategic healthcare leader. That's how I know you as. Shoot, met you 5 or 6 years ago. But I really want the audience to, and I know a little bit of your story. I'm excited to hear a lot of it today, but would love to kind of give the audience some background into who you are, Brenda. We'll get all the way up to, currently the CEO of Lynn Community Health Center, which I'm excited to chat about. But tell us about your beginnings. Who made Brenda, who she is?
Well, first of all, thanks for that introduction. I feel even more wild being in this space with you and Chuck today. So my beginnings really start. I grew up in the Dorchester neighborhood of Boston, and my parents actually had migrated here from Arroyo, Puerto Rico, where they worked in a factory in Chelsea. So I was born in Everett, Mass, so next town over. They divorced when I was very young, and my dad remarried. He stayed in the Lynn, Malden, Everett area, Revere, and my mom moved us to the Dorchester neighborhood of Boston. And during that time, if I don't know if you guys will remember, but during that time, it was the height of the AIDS epidemic and the crack epidemic. Throughout so many neighborhoods in Boston, there was high gun and gang violence, and so I grew up during that time. I grew up, in what I call a hardened time. But I also grew up during a time when even my family, we grew up with food insecurities, housing insecurities. The apartment we lived in was very subpar. My siblings had asthma because of all the environmental conditions that we lived under. We went to the food pantry every week to try to make ends meet, and just growing up in a neighborhood that just was so underinvested in, where people just, you saw the struggle, just day to day. For me, just gave me just a sense of just appreciation for compassion, appreciation for resiliency. Because even throughout all that, you saw people working hard. You saw people trying to do what every other family tries to do, raise their kids well, go to church, and clean their homes and make good foods and make great meals like my mom would do. But it was a very, very, very tough time. And so but I brought some values with me that carry me even to this day in terms of just having those shared experiences, looking for those shared experiences, in this case with the patients that I work with, but looking for those shared experiences has been something that I've held on to from those times.
Thanks for sharing, Brenda. And I'm curious, and we're excited to kind of go through this journey. So thanks for getting us started. Having immigrant parents, has that played a big role in your leadership journey and how you approach leadership and relationships? Tell us a little bit about that if you don't mind.
I would say absolutely it has. So the immigrant story to me is very different than sort of what I hear, out these days. The immigrant story to me, and when I see my dad and my mom, my dad actually was a glassmaker. He worked at a union, and he went into a union at times when people like him were not invited to be in a union, and so he worked very hard to show that he was worthy of being working in a union. He matriculated and he was, led a team. And so he was very proud of that. And he retired and in a way that was, was felt so inspiring for his children, including myself. And my mom worked in a nursing home for almost 30 years. In the nursing home that she worked at, they would call her the N word almost every single day, her first few years that she started. And I remember she was so confused by that. My mom spoke, when we grew up, we only spoke Spanish. My mom, even to this day, speaks very little English, and for her, that was that word was so, she couldn't believe that, that word was being used and being used towards her. And so for me, just knowing that, what people coming into our spaces, whether they're coming into our country, whether they're coming into our organizations, we don't know their full story. And so everyone has value, everyone brings something. And so I, see people like my mom and my family members. I mean, they work hard. And one of the things, and this is the generation I grew up in as well, we were, I call the hustling generation. We worked hard. I started working when I was 13 at a fast food restaurant. And so I have, down the road, the Southie kid that might have been, slinging drugs or something. But underneath all that, we all wanted a better life. We all wanted to work hard. And thinking about, the immigrants back then, that, came here, like my mom and dad came from, US territory, Puerto Rico, or someone that's traveling, much further than that. And, today, we all want just a better life. And so many of us are willing to work for that. And those are the people that I actually align with. Those are the people, I call them mi gente, people who wanna work and improve the lives, not just of themselves, but of other people.
Yeah, that experience really shapes you, right? I mean, we know this as leaders, as CEOs, and any level of leader, especially our audience that are in their leadership journey in terms of understanding how our childhood, our experiences, our families shape us. Those experiences shape us, and those early values of those experiences really carry us, in our life personally, but also professionally. So that's terrific, giving us an insight, brother. Thank you.
And Brenda, before we kind of go on into the next phase of your journey, you shared that your parents had got divorced. How, if you don't mind sharing, how did that affect you? Just because I know it's something that a lot of folks go through. And it happens at different ages, and it seems to affect everyone differently. How did that event in your life affect you?
For many years, I didn't think it affected me at all. And compared to my siblings really felt a sense of loss. I did not. As throughout the years and reflecting on how I grew up, it was devastating. So it was devastating. So, we always were, my mom and dad, were people of little means, but we really fell into, deep poverty. So, it was very difficult. So living in deep poverty, what you're exposed to, is very difficult because what you're experiencing doesn't really reflect the values. It really doesn't, always reflect the things that you aspire to. And so, you're oftentimes judged by what you have, and what you've been able to accomplish, when in fact those circumstances, those situations have very little to do with your personal ambition. But it affected me, greatly. There is, everything from the programs that I would go to, who could take me. So my mom, most of her years being a single parent, either not having a car, not having the ability to take us to certain programs, so we couldn't get signed up for certain programs, or we couldn't afford the dance classes or the extracurricular activities, but more importantly was the guidance. So there's something, an intact home can look so many different ways. And so I'm not purporting that an intact home has to have, this person and this other person, but having as many loving adults in your life, and to guide you and to give you the loving discipline and guidance and feedback is so, so, so important. And so that was missing throughout most of my life. And so, because of that, I would say I ran the streets a lot, and it wasn't, and we all ran the streets. All of us, we kinda came in and out of the house whenever we did. We ride our bikes to who knows where. But many people did that with a sense of security. I did that from a position of from escaping. And so because of that, I encountered a lot of harm in my life, that otherwise I think would not have been there had there been, more loving adults and guiding me in those experiences.
Yeah, it's neat to hear you say that, Brenda. I had a high school football coach. I come from a broken home myself, and great home, but it was just my mom, and I was also called a street kid. That was, but it was a term of endearment in the sense that I was, my mom worked a lot and late and wasn't home. I didn't really have a curfew because I didn't have anyone to enforce it. My mom worked late, so I was out. I'm not always getting into trouble, but I was out, and street kid to me was always a term of endearment of someone that could take care of themselves, and I always viewed it that way. So it's neat to hear you say that you were a street kid yourself.
Yes.
Yeah.
Yeah. Yeah. Latchkey kid, street kid. Yeah. Yeah.
It's amazing. We all have, one thing I've learned is everyone has a story, right? Everyone has stories that sharing, and you're sharing yours in a very deep, meaningful way. Sean has this story. I have mine. I was raised by my mother. My father died when I was very, very young. I'm also first generation American. Both my parents were immigrants. So a lot what we're talking about, I think, I know resonates with me as well, and Sean. So thank you for that.
So Brenda, I'm gonna use an obnoxious sports cliche because that's just what I do. So you've told us a little bit about growing up, and when your parents got divorced, it put some stress on the family. My obnoxious sports cliche, not to oversimplify it, is at the end of the first quarter, you were down a little bit. You had some ground to make up on the scoreboard. Tell us a little bit about that kind of next stage of your life. What did you do, or what impacted you to put you on the course that you're on now as a dynamic leader and someone that elevates so many people?
Well, I would say, the next stage, um, was a rock bottom stage. And so, growing up, was, we're living in deep poverty was very difficult. I ended up being, one of the youngest girls in the nation to give birth, and that took me out of the public school systems. I was thrown out of the public school system. So I had to basically thank God for adults. There was one teacher that would bring me work to do, um, and I read a lot and got through that. Found myself homeless. So with a child, pregnant, and this is when I was starting at undergrad. And so there was, so many moments of really true despair, and I think that there was really no more I could do but to, look for, a little bit of motivation, a little bit of help from whoever was willing to give it to me in order for me to stabilize my housing, to be able to have a job. Fortunately, I was able to marry the father of my two youngest, a wonderful man, and who was dealing with his own health issues, but he was such a loving person, and so we worked hard with the little bit that we had, to raise our young family. But getting that one chance to work, and I actually got a job as an admin at a community health center, and they gave me a shot. They gave me a shot. Somebody gave me a shot, and I took full advantage of that, and so, that really was, a big inflection point in my life. It sort of broke, it didn't break all the chains, but it definitely it broke something in me where I finally began to feel that I can be part of more mainstream work, and I could start to set, quote, "goals," and start to work towards those goals. And, unfortunately, that was early on in my life. It was early enough on enough in my career for me to make the difference, to make the changes that needed to happen in the mindset for me to move forward.
Well, I mean, thanks for sharing all of that, Brenda. And it's interesting. Could you tell us a little bit more about someone gave you a shot, right? Like someone took a chance on Brenda. Can you go a little bit deeper on that? I mean, you don't need to tell us the person's full and last name, but could you just tell us maybe like that experience, or what led the opportunity to you? Like,
Yeah. So as an admin, and at the time, you you had to type very fast. I knew nothing about typing. I remember learning how to type, at least learning the keyboard, I should say, when I was about 8 or 9, because my mom was, going, quote, "through secretary school." But I interviewed with this executive director, and to be the executive admin, definitely did not have the qualifications. But he said, "I see something in you. I see the grit. I see the willpower. I see the determination. And I see the hunger. I see that you want to do this." And that was the shot. And I remember one of my first assignments was to book a flight for him to go to DC. And I booked a flight that had 3 stops. So a flight that should have taken, a little over an hour took 7 hours. And he came back. He's like, "I was gonna fire you. I was gonna fire you, but I've decided not to fire you. I'm gonna give you another chance." And I remember thinking I had never been on a flight before. I didn't know about booking flights. And so, but I tell you, that chance, was so important for me to have that chance to both make mistakes, but also to show, that I could work hard, I can learn, and I can make a difference on the job.
Brenda, what's the Spanish word that you taught me earlier in the episode that I wrote down, but I can't, for wanting to work?
Oh, for wanting to work.
I'll have to send my
Really?
notes to you.
Well, I know that when I'm working with people, I say "mi gente," like my people, like, we're like-minded, we're here for a purpose. Yeah, yeah, yeah.
Yeah, yeah. So that willingness or wanting to work. I mean, it sounds like this executive director, you were their people because you wanted to work. You like you said, that some of the qualifications maybe you had to learn on the job, but it seems like there was something in you that this person saw. And what a cool story.
Yes, yeah. It was the break that I needed. It was, yeah.
So tell us a little bit more about this first foray into community health, Brenda. What did the executive assistant role or teach you? I'd imagine the learning curve was steep as steep gets. Like, tell us a little bit about that part of the early stage of your career.
Oh, so this was and this was about 30 years ago. This is how long it was. And so this talking about circling back here. So here I am working as an executive admin, absolutely no training, no, very little qualifications other than, wanting to do a good job. But at that time, healthcare was going through an existential crisis. At that time, it was, I remember the chief medical officer going, to Jamaica and different places because because of the AIDS epidemic, and it was a pandemic in other areas, and so she would do a lot of international work. I remember budgets being very tight and people having to be furloughed. I remember, our federal grants, being threatened, and really just having very little few resources to really do what seemed to be an insurmountable job. But I worked on all of those projects. I remember, sitting there with the marketing and grants person helping to write the federal grant. I remember sitting in meetings, taking board minutes when the board chair and the executive director and the rest of the management team were talking about efforts to downsize, efforts to restructure the workforce, and listening to all of those conversations, not even knowing that where I would be in this role today, I think was so fundamental in me both appreciating the difficulty that healthcare organizations and particularly community health centers have in this work, but also the just the mindset in it that one has to have, the courage, the boldness, the humility, in order to step into this work, and to be adaptable to all the changes, that come our way.
What was your favorite part of that role, Brenda? If you think back 30 years ago, like, is there any part of that role that when you look back, you're like, wow, that was something I really enjoyed?
Oh gosh, I enjoyed mostly, I would say, working with the management team. I was like the least experienced one, and being in that space with them, I felt like they knew so much, and just being just in service of them. just being in service, like making the photocopies, like, and working late hours, trying to figure out together. Well, I thought I was together. I'm sure they were the ones figuring it out. I was just in the room, but feeling like I was, how I was supporting the team was really making a difference. For me, that was the best part of it.
Yeah, I mean,
Right.
those roles, those executive, administrative roles were so dynamic. They touch so many different things, and I say that as someone. Well, number one, I spent most of the first part of my career in public education, so that wasn't a thing in public ed and in town government, at least as dynamic as it is out in more corporate America. But my wife was an executive assistant for a long time before we had our kids, and she used to get phone calls, at all hours about all different parts of the business. And I used to think to myself, like, if you told me you were the CEO, I'd believe you. I mean, the stuff that you're working on, right? So it's neat. I'm excited to hear just how that exposure very early is going to play into how this journey goes. So how did you start thinking about what was next, Brenda? How long was that role, and when did you start thinking about your journey as far as what was next?
So that role was very short. It was about a couple of years. And the reason I took that role was because I actually left undergrad. I was a young wife, and we just couldn't make ends meet. And so I had been actually a Boston Scholar. And the reason I mentioned that because this was a very pivotal moment, for me in my professional trajectory, because I had kept withdrawing for personal reasons, and ultimately, was no longer a student, was no longer a scholar, and so being in that role, the executive admin role, really gave me sort of the self confidence I needed. I felt like I lost so much to basically go back to the university, and and I was discouraged from doing that. People, most people said were encouraging me to maybe go to a community college. A community college is an excellent path, but that was not my path. I wanted to go back to where I started. And so Boston University, to their credit, reinstated my full scholarship, 4-year academic scholarship, and reinstated me into the school. So that was very pivotal. So I left the EA role and went back to school to finish my undergrad. So it had taken me all together over 10 years. But once I did that, I got an early acceptance into public accounting. And then from there, really began to build on those experiences that led me, from PwC over to the New York Times. And that itself was an incredible, incredible journey. That I would say those work experiences really probably are the most fundamental things that I went through that prepared me in part for the CEO role.
That's neat.
I was going to say it's what I love to hear how you sort of started your career in health, and then obviously circle back after these other experiences to get back into that. Did that early experience impact you in a way, including your mother having professionally also spent some time in healthcare? That influenced you getting into healthcare?
In my first role, it did not. In my first role was really about survival. But once I was there and seeing a lot of sickness, seeing a lot of people wanting to be healthier, and it just was definitely something that stayed with me. And then just personally, I've always tried to work on my own health, my own mental state, my physical state. At first, obviously, was to stay away from harm. As time went on, it was really about more healing, and then from that standpoint, then really working on being stronger and more resilient. And so as I personally have gone through that journey, I've looked to bring others through that journey as well. And now in the role that I have today, I can bring people through that journey of getting beyond avoiding harm to true health and wellness, to really being ambitious about and deserving of the mindset and of the physical well being and the mental well being that we all deserve.
Brenda, what did you study at BU?
I studied accounting, and in management, and I would say, I'm biased. I would say if you're going to be in undergrad business school, those are good foundation to have.
And I don't want to assume, but when you landed at PwC, was that in an accounting and finance role?
It was an audit, yeah, in professional services, yeah. Yeah, so I spent a few years there, and then, when the New York Times, was a publicly traded company and owned many, media companies across the country, across the world, including the Boston Globe, I went in there, as a corporate controller, and that was I would say, my first really professional outside of PwC, my first professional job.
Well, that's neat. Well, we have this really cool foundation of really persistence and perseverance to get into, corporate America and into a really professional role. The journey up until this point in and of itself is pretty amazing. Tell us a little bit about now PwC, New York Times. What kind of launches you into the leadership phase? And I don't want to skip anything, so help me fill in some blanks here, but help us build this bridge here a little bit, Brenda.
Well, so I would say, that I mean, the bridge was really a lot of it was, working on boards, serving on boards, I should say. So throughout, between, those experiences that I had working in professional services and media and in education, and then landing back in healthcare, um, really was both matriculating in those roles. And so what I mean by that is every industry I found myself in, it was during a time when they were dealing either with a significant they were in a downward cycle, or the industry was going through a seismic change. So when I was at the New York Times Company, it was during the time when print media was going down. And print media was going down when we hadn't yet made the transition to digital media. So digital was a commodity, and the big elephant in the room was how do you curate that commodity in a way that elevates that value and where you could put a price point on it that people are willing to pay, and that is can support the survival in the cost structure to be able to deliver that information. And so I was part of the teams that did the financial models. I was part of the teams that worked on these amazing projects to answer that very question. So what we take advantage of right now when we open up our mobile app, and we have a subscription, there was a lot of work that went into, how to curate that and how to do that. And so I was very fortunate to be on those projects and on those assignments. I also worked on projects and assignments that, I say that some people weren't willing to do. One of the things that I had the opportunity of doing, and at the time when offshoring and outsourcing was very popular with manufacturing companies, media companies had not done that, and it was a kind of a risky thing to do. But the New York Times Company, started to dabble into that. And I made a case for having my unit at the Boston.com to really engage in that. We were leaving millions of dollars of receivables on the table, unbilled, because we were growing at 34 to 40% per year. So totally different from the print side. So I went to India and we worked with a team to transition some of that back office work. And even though today those projects are different, the fundamental, the underlying premise is not different. You have to be able to go into spaces where others are not willing to go and do the work that others may either overlook or do not value in order to get to the other side of really truly what's going to disrupt and what's going to improve and elevate the things that you want to do in order to do your best work, and come up with your best product and have your people, your workforce really focus on the right things. So working on those, on having a lot of those experiences, I had partnered, with the Attorney General's office while I was there because unfortunately we had breached 250,000 credit card subscriber information. And so I was asked to do an investigation, and that took a lot of professional risk to do that. But again, went through that process, and we got to the result that we needed to get to, and overall it improved. At that time, the controls of the organization, and so all of these different experiences for me. was part of the bridge, and then service. So I served on a community health center board for over 10 years as a patient. So one of the things throughout all of this experience, I've been a community health center patient. So I say that that is that is sort of the pillar in my life that has withstood throughout all of these personal professional experience, is that I've remained a community health center patient. In the beginning by need, but now from out of choice. And I want every single person, no matter what your background is and what choices you have, to be able to select a community health center as as your preferred place of getting care. And so, all of those experience and the service really has been the bridge for me moving back into healthcare.
You shared so many amazing pieces there, Brenda. But I'm kind of laughing, not laughing, but it's funny to me because when I first met you, it was about 5 years ago. It was COVID times. You didn't have much going on then. Uh, you were busy. But it was interesting, and I don't wanna tell your story, so I'll just bungee jump in here. But you were in the chief strategy, and finance officer role at Lowell Community Health, and, we were chatting about everything. We were at the Celtics game and, some of your CFO peers. What we were chatting about, of course, my day job, I'm an insurance, consultant, so I'm picking your brain on that, and you didn't really wanna talk about that too much. Everything that you were talking about was very kind of, forward-facing, progressive, strategic, talking about the future, and I thought that was so interesting at that point, but you bring us all the way back to Boston.com, and that's kinda been your thought process, it seems like throughout, or at least a big part of your career. So long with the way of asking the question, when did you know that you wanted to be a CEO, or wanted to drive strategy the way that you really, it seems like, enjoy doing? At what point in your career did you know that that was somewhere you wanted to be?
It was I think it was always in me. I just needed to tap into it. But really being a CFO during the pandemic, absolutely. For me, so many of us coming, out of that experience, which was heart-wrenching. You can't be the same. You can't be the same, being in healthcare. And so, being at Lowell, I worked really in primary care. And our providers were burnt out, but it wasn't only our providers that were burnt out, and it wasn't only our care teams that were afraid for our communities and our patients and for our loved ones. It was folks like myself working in administration, whether in IT or in billing, or our community health workers and our call center. All of us carry the weight of being able to protect our patients and protect our community. And um and I had an epiphany during that time, or it's an epiphany or an awakening. I don't know what it was, but I believe that in my role was actually instrumental as a CFO and as a strategy officer, that my role was instrumental in saving lives in the community. And I really believe that. I believe that first and foremost because I was, again, a community health center patient and I brought that perspective, but also because I saw that I could tap into my capabilities and the capabilities of my team to ensure equitable administration of the vaccinations. So what was happening across the board and what we were all seeing is that people like myself, that are educated, that work in healthcare, that have access to systems, we can get in the front of the line to get vaccinated if we chose to. There's so many people out there that did not have that opportunity, and I saw that looking at the statistics, I could see people being left behind. And of course, some of us, we're trying to explore different reasons. Maybe they just don't want to get vaccinated. Maybe, all these different reasons. And so I was so adamant in just in terms of what I believed is that that might be true, but it should never be the reason. We should never be the barrier of why someone who may want to cannot get in. And so I started creating new reporting systems. I I partnered with an AI company, and that's before, health centers started doing that and healthcare organizations started doing that in a way that they're doing it now, to really begin to do outreach, whether someone spoke English, Spanish, Portuguese, Khmer, Vietnamese, it didn't matter. If it was time for you to get your first dose, you should know that it's your turn. If it's time for you to get your second dose, it's your turn. Really monitoring the chronic conditions and who was eligible for what at what point, and creating that management and reporting system for me was so powerful because I could see the difference that we were making, and looking at those rates compared to what those rates look like for the city, what they look like across the Commonwealth, and we could tell our story. We could tell our story to funders, but more importantly, we can tell our story to our patients. We could say, "Congratulate! Look at what you've done. Look at what we've done together." And in keeping you as healthy and whole as possible. And so I knew then that this industry and needs leaders like myself, needs transcendent leaders, needs leaders that you are not just you see your swim lane, um, but we are in this big broad ocean together. And we have to somehow, cross, and extend our arms in making sure that whatever we state is our mission, that we're all working together with shared accountability in doing that. And so I think that really was when I knew, not that I wanted to be a CEO, but I knew that I would be a CEO because that is for many of us there is something that needs to break in us, and for me that was a shift that occurred. And I'm very fortunate that I recognized it and others recognized it as well.
I mean, we could do a podcast just on that alone. We could do a podcast series on leading LCHC through COVID. So thanks for sharing, Brenda. And I again, we could spend forever chatting about that and the amazing work that everyone was doing there. But for the sake of kind of the conversation, the podcast, I know that we're recording this in mid February. I know that we've just come up on your 1 year anniversary of being the leader at Lynn Community Health Center. Tell us a little bit about that part of your journey, about the decision to come lead Lynn Community and how it's been.
It has been fantastic. It's definitely a hard job. I think that I've thought about, well, why didn't somebody give me the playbook? And now I'm realizing there is no playbook. And so what I've learned, over this past year, that it's not enough to be, what we call the professional leader. You at minimum have to be the professional leader. So you have to look for efficiency. You have to manage budgets well. You have to do strategic planning. You have to have good systems in place, and you have to position people in the right roles to accomplish, all the many things that need to be accomplished. And I try to do that. I try to do that well. So I set goals throughout the year to do that. What I learned this past year is that in and of itself is not enough when your industry or your organization is dealing with an existential crisis like we are today, with workforce challenges, where we have very few providers going into primary care, where we have, care teams that still say, I'm burnt out. And there's been such an underinvestment in our systems, in our workflows. And so it really takes a deep focus and deep engagement, and really looking at our culture, looking at our practices, looking at, how as a manager and as a leader can I really engage in a meaningful way with my leaders, and do I understand my number one job? And that's one of the things that I've been learning this year. My number one job, I have a lot of work, but what is my number one job? And so my number one job, like yours here today, is to really lift the agency of our people. It's really to build. And to really unleash, the motivation and the inspiration, the ambition that people have, and bringing that to bear in order to really accomplish something big. Are we going to have goals? We're going to have goals. We're going to have priorities. We're going to have all of that. But really, it's the spirit and energy behind that work, and that collective power that really brings about the community health and putting that at the forefront.
What's been the biggest lesson learned for you? I mean, a year, congratulations. That's an amazing first year, I'm sure, to be CEO. What's your biggest lesson you've learned so far this past year?
My biggest lesson learned has been that I have to continually share my message, continually share a message of strength and a message of hope, but also a message of standards and elevation and expectations. And so that has been a big lesson learned for me. That when people are feeling down, really mustering up that strength to acknowledge them, but to say, it's on us and we need to make this happen. And so that's been a big lesson learned. And to bring people along and let them know that's what I expect. That's what our patients expect. That's what our community expects. So that's a lesson learned. It's been a tough lesson learned.
Hmm.
Uh, Brenda, I'm curious, to bring it full circle, in your first year, as CEO and in your first CEO role, have you had any moments where you booked three-legged flights? Maybe not specifically, but was there any part of this role that that took you by surprise or that you weren't aware of until you were in the moment facing it?
Well, I would say that I was hired when I got the offer. I had said, "Oh, so what made the difference?" And I was told, because you're a change agent. We believe you'll be a change agent." And so, but there's one thing to be brought in as a change agent. There's another thing to really get the buy-in along the way. And so, even from the very people who hired me, so I'm very fortunate to work with a board that they are very active in the community, very supportive of our community health center. And so my understanding throughout this year of the need to ensure that I'm an unknown commodity, and understanding that and really building that trust, not just necessarily in my ability to do what I need to do, but in the intention behind my actions. So that is something that for me, has been when I have not had those conversations. And now I'm learning to have those conversations more timely. But it has been like, booking that 7 hour flight, But thank God for grace. I have to say, I've been extended some grace, and I appreciate that.
Well, I love that, Brenda. We're just kind of towards the end of the pod, and this is where Chuck and I get to have a little fun. The whole thing's been fun. It's been a lot of fun, but we get to have a little fun with our guests and kind of go rapid fire with some. I don't know. I think I don't know, Chuck. They seem to be easier questions than what we've been chatting about. But first question, Brenda, if you could give your younger self one piece of advice, what would it be?
It would be to move on faster. Trust your instincts. Do a gut check. Sometimes we're so paranoid we can't trust our gut, but do a gut check and trust your instincts. Go with that.
All right, I love that. All right, favorite book or podcast on leadership, not the Lead CEO podcast.
Okay, so I would say it's not my favorite book, but it has been one of the most influential books that I've read. I would say over the last 4 or 5 years, and it's called The Motive. I think Patrick Lencioni, who did the 5 dysfunctions of a team. So if you read The Motive, you don't have to read, hopefully, the 5 dysfunctions of a team. But it's a fable, easy read. You can read it in a couple hours. And so I had shared it with my team, that it really, if any book that I've read, that is the one book that influences my leadership style. And, essentially it's really about your number one job. What is, and doing your number one job.
All right, that's great. We'll link that in the show notes for sure. One habit or routine you can't live without.
One habit or routine. So for me, there are two. One is I have to do something physical every day. And so either smiling or walk or run. And so something that really engages me with the world. And then I also listen to, it's my little thing. It's meditative, but it also again wakes up my soul. Is Growth Day app. So Brendan Burchard. So I listen to probably 5 6 days out of the week every morning. I listen to that. So to get me charged mentally and get me in the right space.
And I'm sorry, what was it? What's it called again, Brenda? Growth
It
Day app?
it's Growth Day. It's just called Growth Day. It's an
Growth
app.
Day.
Yeah, and so
Yeah.
so those 2 things I would say, getting up and just really getting my body awake and getting my mind and my spirit awake. And again, just for, sometimes if I have a couple of hours to do all that, great. If it's 15 minutes is fine.
Who inspires you?
Oh, who inspires me? This I don't know how this is gonna come off, but I would say my younger me inspires me. And just thinking about just all that heartache and all that turmoil, and that definitely inspires me. That it doesn't matter what I'm going through today, if I got through all of those experiences, that I'm in good hands. And but my mom inspires me because she represents what truly what I see so many patients, and even where, our country, when I think about, what are the ailments, right now facing so many members in society in terms of chronic diseases, in terms of just, really just trying to get through the day to day. So many of us are just trying to get through the day to day. And that's my mom. And yet her humanity never fails. Her compassion never fails. Her love never fails. And so that inspires me so much that
Allah.
seeing a woman like that who's so resilient, I mean, man, that gives me hope.
That's really good. That's great. I one more question I want to ask. It's not a rapid fire question, but hey, I love to hear, not just because you've been the CEO for a year, but your just overall journey. What advice would you give to those that are aspiring to be a leader or, are continuing to advance their leadership journey? What advice would you give?
I would say, obviously I put a lot of emphasis on work, but I know people work very hard and they toil and they're just a cog in a wheel. They don't feel like they're going places. Get around people that are doing more of the things that you want to do. And if that is speaking in public, whether that is doing a presentation, whether that's analyzing, reports, but I think that that's so important. And then as you're growing and getting more responsibility, never forget that shared accountability, and never forget whatever that first job is. And so I see so many leaders, they take a lot of pride in delegating, and I think that that is really not the right message for us to be sending other aspiring and emerging leaders. Don't focus on delegating work. Everyone should have a meaningful job to do, meaningful work to do. Really focus on helping them, and those that you work with, to really bring out their best selves, to summon their very best. And the more you focus on that and delivering on your commitments, practicing those great habits, and really, looking to help other people shine, and not just look for sponsorship for yourself, but sponsoring others. When you see some people, when they raise their hand, not to just say, "Hey, can I go to this fellowship? Can I go to that conference? Or can I, get nominated for that award?" But when you raise your hand and you say, you know, my colleague over here, I've noticed that she has done XYZ. I think she's worthy of being nominated for this. Or, this person over here that's been, they're like an unsung hero. I don't really know them, but I see the work that they do. And so the more that we can do that, I tell you, there's nothing more satisfying than being self-serving in that way. And call it karma, call it whatever we want to call it, but it is something powerful in that is one thing that no one can take that away from us. It's our ability to lift other people.
That's so cool, Brenda. Yeah, I just had lunch with a really good friend in leader in the Boston area, and he sent me a text after, and it was really short and to the point. But he said, "I'm trying to do a better job to never miss the opportunity to recognize someone doing great things. Whether it be small or large."
Yeah.
And it sounds like just what you just said. Like, don't be afraid, or don't lose the chance to recognize the team aspect of everything that we're doing. Right.
That's it. If you recognize a person, and as you're recognizing them, you actually expand recognition for so many others, including yourself. If you only look to recognize yourself, you only get the recognition for yourself. But if you recognize others, now you have someone who you've recognized, someone that may recognize you in the future. And by doing so, you've already, if you do it in an authentic way, it really opens the doors for others to do the same.
Well, Brenda, this has been a blast. It's been so fun learning about your full journey, and shoot, we could have spent 2 more hours, diving into all of the fun details. But thanks so much for spending some time with us on the podcast today.
Thank you so much. It was great being here and sharing my story. Thank you.
All right, we'll see you soon.
All right. See you soon. Thank you.